Back now with infectious disease specialist Dr. Frank Esper for reaction to what we just heard in our last block. Concerns that a 21-day Ebola quarantine period might not be long enough. And doctor, we have some positive news today with the quarantine ending. But what do you make of the assessment by researcher Charles Haas that no amount of quarantine will provide absolute assurance? Should we be concerned about this number 21?
No, the answer is that 21 days actually works. Nothing in life is ever going to be 100%. But what we do see in this outbreak, as well as in the outbreaks in the past, is that if we monitor the exposed individuals for over 21 days and they do not show an infection or any symptoms, then we're able to actually control the outbreak. 21 days is important not for any one individual person, but 21 days is important in order to stop the spread of this virus in this country as well as others.
And doctor, as we look at the reaction here around the country, some people breathing a sigh of relief, feeling like maybe we've turned a corner, and yet, as you've said and others have told us, a lot of folks want total certainty. People want that at an individual level when they see the doctor, and they certainly want that when thinking about the risk of infectious disease. How much of the entire reaction to this and the Washington political reaction do you think reflects a desire for a type of certainty that does not exist in the medical arena?
Yeah, as we were just talking, the fear of Ebola lasts a lot longer than 21 days. And unfortunately, the fear is one of those aspects of this disease that we have to address as much as the virus itself. For the people who are on the street, the people who are going about their normal daily lives, they should not be worried, and they should be feeling a lot better. The less we hear about Ebola, the less we hear about the patients and how well they're doing, the better the news tends to be. But from a physician standpoint, from the people down in the emergency department to the people in the intensive care, we must remain vigilant. Not just for this outbreak that happened in Dallas, but for the next outbreak that can come to our shores and may show up in Peoria or Springfield or wherever. We, as a physician and as a medical community, we must remain vigilant.
Yeah, and to your point, doctor, there's a lot of misinformation out there. New polling from Harvard School of Health, 85% of Americans incorrectly believe that they could get Ebola from someone sneezing on them. 52% fear a large Ebola outbreak in the U.S., something that has a, minuscule possibility of actually becoming a reality. 38% are worried that they or a family member may become sick with Ebola. So how do you strike that balance of assuaging some of these fears, educating people about the real, very low risks that Ebola actually poses to the American public without further stoking hysteria just by focusing too much on talking about Ebola?
We need to address Ebola with respect. The disease requires us to be very vigilant. The disease requires a certain amount of appreciation for what it can do if we do nothing. That being said, the disease is spread to family members and to healthcare workers. It is not something that is transmitted to people walking along the street. It's not something that's transmitted to people in the grocery store or anything like that. It's to very close, prolonged, intimate contact that comes from being within a family with someone who is suffering from Ebola, or being a medical care provider who's going to be working with a patient with this disease day in and day out. Those are the people who must remain vigilant, as I said before, but the rest of the country, as we continue to watch those who have been exposed and we don't see any new patients who are coming, should be feeling a lot better each and every day that we don't hear about any new cases.
Doctor, we have a new, a first-time ever Ebola czar coming on the job on Wednesday. Do you think that this person will be able to help you do your job? And do you think that the Ebola czar should have been a medical professional?
I don't necessarily know that you need a specific physician or doctor to be the person that's in charge of Ebola response, because there are three phases that I see that are required in order for us to make the American public a lot safer. One, we have to deal with the Ebola problem here within the United States. That's in Dallas, as well as those nurses that are now in Atlanta and over in Maryland. Two, we have to be ready for any new cases that may show up on our shores, in our emergency departments, or in our clinics, and that's on the physicians and on the hospital staff to be ready for those. And then lastly, we need to deal with Ebola at its source, and that is in West Africa. So these are not physician questions. These are not a problem that a physician would deal with. What you need is a leader. You need someone who is good at administration, that is good that actually has the authority to ensure prompt response, ensure correct response, which we didn't have before his announcement. So I'm very happy that there's someone there.
Has the CDC been helpful to you in your hospital in doing your job and getting prepared? And what changes do you think we might need to see from the CDC going forward?
The CDC has been very, very helpful for not just over the last several weeks, but for the last several months. We have never been wanting for guidance from the Centers for Disease Control. They have always been out front in providing our hospital and our staff with information, up-to-the-date information, and revisions of information as new sources and new data come in. We are almost always inundating every day. Now, here at our hospital, we are meeting every day with revising our protocols, understanding what's going on. And I'll tell you, you mentioned a few minutes ago about how doctors are talking to other doctors about things that went wrong or problems that they had. Actually, I would tell you that the people in the United States should be actually very reassured that that is happening. We're not trying to hold back our missteps. We're not trying to hide anything. If we had a problem, we are letting the physicians know what problems we had, how we dealt with them, what worked and what didn't work, so that other physicians, if we are unfortunate to have another case, will not make those same mistakes again. I'm actually very reassured, and that dialogue is going on right now.
Yeah, certainly more of an optimistic tone today. Dr. Frank Esper, thank you as always for your insights.
It's very good to be here. Thank you.
All right, up next, the one number to keep in mind heading into November's midterms, and later, the game of keep away everyone is talking about. Much more cycle ahead.
He understands now. New York State is